Dr. Rosen.
Thank you so much. Well, I go by Dr. Jordana now because I've got a lot of vets in my family. My sister is a vet and she was Dr. Eisenstein. And when I started practicing and I would go into an exam room, I'd be like, hey, I'm Dr. Eisenstein. And we look so similar that they'd be like, yeah, obviously, like I just saw you last week. On the other Dr. Eisenstein, and it just got really embarrassing. And so anyways, just go by my first, it's a whole lot easier. But yeah, the relationship that we've had with Vicky has been so special from day one. And I think it started out of convenience, but the mutual respect that we have for each other is, it's magical. So, I love working with you guys too. So EVS, well, before I even get into that, this is my cat Junior. She came from here. She was part of this hoarding situation, and I think she was the only kitten that survived. And I brought her home and I told my husband, oh, it's just going to be for a few days. Like, she doesn't have a home, and look at her. And he was so mad. He was so mad. And he was like, this is ridiculous. Okay. And then he stormed off. And lately I get texts, did you feed Junior lunch? Oh, like, pictures of her. So I know she is a beloved member of our family. I've been a vet for almost 20 years, and I love every day of it. And I started at Banfield. My sister, like I said, is a vet. She owned that Banfield, and I came in as an owner with her. We worked there. I worked there for about 10 years before we ended up selling. And I do not drink alcohol, anyone who knows me. But that day that we sold, it was like, pop the champagne. We'll never own again. We'll never manage people again. We'll never deal with the business again. And I'll put in air quotes, I went into the real world of veterinary, and it was kind of scary. I mean, just what you saw in different practices, kind of felt like each practice was going rogue. And I realized after a couple years, there just has to be a better way. And so it kind of brings me into, hopefully I can navigate here, the challenges facing the veterinary profession right now. And a lot of people think being a vet is just great and happy, and you deal with puppies and kittens all day. And there's a lot more that we're struggling with as a profession, that I felt it was so important that we're going to take the reins as veterinarians, and we're going to make the change from within. And so if we wait for someone else, if we wait for the big corporate companies to come in or private equity to come in, we're never going to have a say. And it's going to kind of go down the road of human medicine, where you're just kind of working for insurance. And so here's, I kind of outlined it as three big things. Work-life balance. So when I graduated in 2005, the veterinary profession switched genders in terms of the who was in the majority. So when you looked at the pictures of veterinary schools back from like the 1930s up until 2005, it was all men. And now you look at them and it's pretty much all women. And I think we have to own that, right? What does a woman working as a veterinarian look like versus a man? And so women are really balancing children and school schedules and pickup and drop off, and really having that dual life. And not that men don't, by all means, they have that as well. But I think it is pretty statistically based that we have a much stronger burden. So to have a woman working as a veterinarian and working weekends and nights and always wanting to say yes to those patients that are coming in, and constantly feeling like a bad person if you're saying no to that limping dog or a dog with diarrhea, it really goes into that second thing of compassion fatigue. When I think about compassion fatigue, to be honest, in nowadays, it really, for me, the biggest driver of that is cost. So when clients are coming in with a pet and they need to have a surgery, and what used to cost $3,000 when I graduated is costing about $10,000 nowadays. And so you're seeing a lot of these pets who are then being euthanized because owners can't afford their care. And that takes a huge toll on veterinarians. because they don't have the capacity, not even the capacity, they don't have the authority to say, don't worry, I'll just do it and we'll just get it done and you'll take home your pet. We all want to say that. But again, when you're working for someone else, that is not your call. And then the last thing is burnout. So one of the things that I think hurts me the most as a vet is when I see my colleagues who spent their entire life dreaming about becoming a veterinarian. And when they finally do, they say, whoa, this is not for me. This isn't what I expected. Didn't expect the late nights, the angry clients, the phone calls nonstop, the text messages from my random neighbor back in grade school who's asking me about their goldfish. Like all of those things are just not what they are expecting, and they want to have a life outside of work. So these were the challenges that after, again, selling, going and working relief, working in as associate, I kind of took on and said, I have an idea. So there has to be a better way. And for me, that was Pet Urgent Care. So this was probably in the spring of 2021. I was sitting at the pool and it was a beautiful day. And I was there with my kids, and they're little at the time, right? I mean, they're not really like going to be having this capacity to have this conversation with me. And I was like, oh my God, guys, I have a great idea. We can open urgent care for pets. And they're like, okay. So, what did that mean to me? It meant being an in-between between these general practice vets and the emergency rooms. It said to the general practice vets, take a lunch, go home on time. When your schedule is full, send me the diarrhea, send me the limping, send me the vomiting, the bloody urine, so that you don't have to see all those patients. That burden isn't just on you. And to their clients then, it was a great way to say, listen, I know you've been at Terry Animal Hospital for 30 years and we are your vet, right? But I know Dr. Jordana, and I know she'll take good care of you, and then she'll send you back here for a follow-up, versus what usually was happening of, sorry, we can't see your pet for, whatever the ailment is, but we have an appointment next week. I was like, well, that's not helpful. Or you can go to the emergency room. Also not a great option. The time and money that we're going to be spending at the emergency room is exorbitant compared to what you'd be paying in general practice. To the flip, to the emergency clinics, what I wanted to do for them is say, you deal with the emergencies, right? Those dogs that got hit by a car, those dogs that have a bleeding problem, those pets that need to be stabilized, and send me your broken toenail. Like, why does that have to go to Blue Pearl, right? And so that's where I thought, how do we make this profession better for everybody? It's bridging that gap in care. I kind of like to think about, after 2 years of opening EVS, I think our main theme is we are the clinic where reality exceeds expectation. And a lot of that is just really the expectation is so low right now. People aren't expecting to go in and get blown away by the experience of the vet, because it's not what they've been given, especially since COVID. So let's call it the last 5 years. We got into this culture where clients were dropping their pets off in the vestibule, and then calling back and forth of, what's going on, and things were just constantly slipping through the cracks. And the care was really frustrating. I think it was frustrating for me as a vet. I could only imagine as a client how they felt leaving their pet and not being with them. When they're coming to EVS, they're getting that mom and pop, they're getting that high touch experience. COVID scarred me from drop off. I don't want anyone to drop off. I want them to be with their pet the entire time. So it's so important to me that they're there, they're with their pet, they understand the importance of the physical exam. And when their pet is, moving around or yelping, they're seeing why that's happening. It's not this scary thing that's happening in the treatment room. And you're like, oh my gosh, what's happening to Buddy? They're hurting him. They're seeing it, and they understand the importance then of, listen, I'm seeing this on my physical exam. You witnessed it. And now I want to do these tests. And this is why. And I think that piece is so important. Our clients are just so involved in that diagnostic workup. And there's plenty of times when clients are like, listen, I don't want to do those diagnostics today. What else can we do? And for sure, we can do a supportive approach. But they know that if those supportive approaches don't work, they know what those next steps are. And to me, that's so important. After a few weeks of being open, I got a phone call, and it was this frantic client. And she said, my dog, he needs a neurologist. And I was like, dog needs a neurologist? Like, why are you calling us? Like, this just seems so strange. And she said, my vet told me that, my dog needs a neurologist, and I'm just calling around to see where I can find it. Now, I bet that vet did not say those exact words, or there was some additional information that was provided so this client wasn't on this wild goose chase for a neurologist. But it was so apparent to me that even if they did say it, it wasn't conveyed in a way that the client understood. And so for me, it's the first time where I'm writing medical records and I'm sending them to a client, and I'm sending it to the regular vet, that the pride that I take in these records is so different than anything I ever wrote at Banfield. I'd be embarrassed to read those right now. But most of the time when a client leaves the vet, all they get is a receipt. And it's like, I spent $500 and my dog got everything. And then we dig a little deeper, and it's like, no, you spent $500, yes, but like, you got the rabies vaccine and a heartworm test. That was it. And they're expecting, they got everything, that they got blood taken, so they expect that like the full panel of blood was done. And that was, again, very eye-opening for me. Another time a dog came to EVS and they just had surgery, and the dog's incision was infected, and they said, but we have medication. I'm like, okay, just show me what you have. And I looked at the vial, and it literally just said medication. So I say that not to, throw any vet under the bus. For me, it's all a learning experience. How do we make sure that what we're sending home, you understand as a client, what is this medication? What are the potential side effects? What should we be looking for in terms of them getting better? Where are you supposed to go if they're getting better? Or what does that follow-up look like? Or do you need a neurologist? And I will tell you where to go for that. But that is where EVS is exceeding that expectation, because we want to go that extra mile. If I'm going to refer a patient to Blue Pearl because they need surgery, you can bet that I'm calling Blue Pearl first and saying, can you take this patient? Because there's been plenty of times that I've called and they said, we don't have blood, or we don't have, certain specialties here on the weekends, and, don't send them here. The last thing I want to do is send a patient over there and they're sent somewhere else, and just increasing the fear, anxiety, stress of the patient and also of the client. I also want to make sure not only can they take them, but that I know how much it's going to cost, so that I can relay that information to them. Because again, the last thing I ever want to do is know that it's going to cost $5,000 for them to help a cat who maybe has an obstruction, and they get there and they don't have the money for it, and they euthanize when they get there. So for me, that transparency is so important, to make sure that everyone is on the same page. And so when they get those records, their medical records, again, they're just not expecting it. Most times clients are like, I've never seen anything like this before. I didn't even know that this was going on with my pet. And they're so pleased. And when I see the Google reviews for our clinics, it just reinforces this, that clients are not the bad guys. They want what's best for their pet. They're scared, they're concerned, they're frustrated that they couldn't get into their regular vet. And again, they're very surprised when they come to us that they are getting that level of care and attention. So put together these cute little slides here of, expectation and reality. So one of the things that I also pride on EVS in doing is really owning technology and saying, like, yeah, there's some scary things with technology. I have a 16-year-old son. He has been called to the office so many times for using ChatGPT. But for me, technology, it can be used to help us. So the first thing is, how do we get people to not wait in our waiting room? When I look up into a crowded waiting room, that gives me a lot of stress. And it's like you're panicking and you're rushing and it's looking through all the files. Okay, what's quick? What can we get done quickly? And just, kind of bump things out of order. And that's when I would always get myself into trouble. So I developed an app where clients can actually check in online. And in addition to just collecting their demographic information, it will collect a brief history based on their presenting complaints. So if you've ever been to the vet and your dog was vomiting, they're going to ask you all of those same questions. What are they vomiting? When are they vomiting? How often are they vomiting? Are they still eating? So you're going to, as the owner, do some of that work so that by the time you come and see us, we already have all that information. And you're going to be able to get put into an exam room. The technician will be able to kind of tweak that history, maybe ask a couple more questions. And in a regular setting, what would have taken about 20 to 25 minutes should take about 5 at EVS. So just the amount of time that you're spending waiting to be seen is dramatically reduced. It allows you to check in from the comfort of your own home. It allows you to, if you are at work, but you're going to have to bring your dog later on, pick a time frame later in the evening, which is a newer feature. So I was very excited about that. It's amazing to build something and, kind of see like where you went wrong and be able to fix it in real time. So that's been really great. And again, clients are just so excited that they don't have to wait in the clinic. When you're third in queue, it tells you to come on site. Some people don't read instructions, okay? Like there are those people that I didn't know there was an app or they just show up, but that's okay. We'll take care of them too. But the people that follow the rules definitely, I think, have the most elevated experience. Another thing that was kind of I don't want to say that it was not a deal breaker for me, but it was very important to me that our clinics are opened on the weekends because this is really the most important time. Most clinics in our area close early on Saturdays if they have hours at all, and the majority of clinics are closed on Sunday. So it really means that if your pet is sick, injured, ill, not feeling well, you're going to the emergency room on the weekend because even if your vet is open, those appointments book up super fast. So this is amazing. We're open 7 days a week. Also exciting, we just expanded our hours. So now we're open till 7 p.m. every day, even on the weekends. So especially getting into summer, which again, didn't know that there was a seasonality to pets being sick, but definitely summertime is when they are sick and injured because they're all playing outside. It's amazing to be able to be there for those clients as well. We kind of chatted a little bit about the bill too. It is, I would say, 4 times the cost to go to Blue Pearl as it is to come to EVS. I publish our office visits on our website because that's the most common question that we would get when people call. So it's $115 to come and see us. And I wanted to make it affordable. I didn't want this to be that you spent all your money on the exam fee and now you can't do anything else. And when you call around to the emergency rooms, their prices are, again, 3 or 4 times what we are. There is reason to that. Again, I'm not sending them under the bus too. They're staffing a 24-hour hospital. They are equipped for any emergency that walks in the door. And so that is obviously going to, cost a whole lot more than, again, being in a much more niche area of practice. And this idea of feeling rushed. So when I worked in GP, we had general practice. Our appointments were somewhere between 15 and 20 minutes. And there was always those cases of it's just a booster. And then they would come in and like, oh, but actually he's been having diarrhea for 6 weeks. I'm like, wait, what? And then your whole day is just derailed, right? Because you're not going to be like, oh, sorry, come back tomorrow for the diarrhea. And so those appointment-based systems are just so flawed because you're always scrambling to be somewhere else. In general practice also, not only are you seeing appointments, but you have those pets that were dropped off, to be seen, or you're doing surgery and surgery, kind of has a complication and then your whole afternoon gets, bumped into the later hours. So not having appointments and being able to say, whatever is in front of me right now is going to be the most important thing at this time. When I worked emergency and I would have a dog, I think I had a dog come in that was pooping worms. I literally rolled my eyes. I was like, this does not belong in the emergency room. Okay. Like, and the dog it's a puppy. Of course it's pooping worms. And then, I remember, just kind of like, all right, here's your medicine. But as you're seeing those cases, maybe it's pooping worms, maybe it's an ear infection, maybe it's, a little skin rash, and something more critical comes in the door. I mean, you could be sure that they're getting, here's your meds, hope all is well, and you're moving to whatever is more critical. By staying in this lane of urgent care and not having the preventive care piece, which to do correctly takes a lot of time, and not having the surgery or hospitalization or those critical cases, I can stay and spend as much time as I need to with whatever case is in front of me, and then say, we're moving on to the next one. Even with the app, we really try to be really intentional with the language that we don't use the word appointment anywhere, because I don't want anyone to think they have a 4:30 appointment. I just want them to know that they're third in line. And when they're, when it's their turn, they are going to get the exact same attention that those in front of them do. There are times when, some of our clinics are much busier and people get impatient, and that is just human nature. But it's so important to me that we're taking the time, and clients are understanding, right? Even if they're coming in for an ear infection, I want them to know what that ear infection is and why did it happen and what can they do to prevent it, instead of just this band-aid medicine of here's some medication, here's some ear drops, maybe it will work, maybe it won't work. And clients are still so confused, right? They don't even know why their dog keeps having these ear infections. So that is, it's been a really special part of EVS as well. Okay, I think that's all of my slides. It was a beautiful slideshow. I can answer any questions. Yeah. Sometimes we don't know, right? And I think that's just like the honest truth. I would love to say black and white, right? Like your dog's hit by a car, go to Blue Pearl. Your dog has an ear infection, come to us. Those are the obvious ones. The non-obvious ones are what we call ADR, ain't doing right. I don't know, right? So a lot of times I recommend come to EVS, let's do an assessment, right? Let's do a workup. And then I can call Blue Pearl and say, listen, Fluffy came in and her hematocrit is 11 and she needs a blood transfusion. And they're much more able to tailor a treatment plan and agreeable to take this pet versus me saying, hey, I got this like 11-year-old dog who's kind of pale, like, can you take it? And they're like, yeah, I can get it to the back of the line like everyone else. By doing the workup with us, you're still going to save a lot of money because even our blood work packages and our x-rays are a whole lot less than they are at the emergency room. And it gives clients a time to process even what it means to go to Blue Pearl or vet specialty. I'm not singling them out or any of them. Because I want them to know, as sometimes clients they just need to know, like, is it time, right? Is it not that it's not worth it, but do I want to put my pet through heroic measures to maybe be saved? And so that's always for me a conversation. And I'm always willing. We in our Northbrook location are very lucky. We're very close to Blue Pearl. So have there been times when we had a pet come in, you're like, whoa, that does not belong here, right? I'm talking respiratory distress or a bloated abdomen, like where the stomach flips. Yes, they've come to our lobby and we have like a brief conversation with them of this is what we see is happening. And if you want, more elaborate care, this is where you need to go. And fortunately, there are maybe a 7-minute drive from us. So that's really nice. And that's great. But yeah, sometimes you don't know. And I guess that's my non-answer. So there's like ideal situations and then there's like reality. So ideal situation, yeah, we call your vet and we say, hey, Fluffy's here, she's having diarrhea. And they're like, yep, she's had diarrhea like every month for the last 12 years. And they send us like this novel of records. More frequently, especially on the weekends or once their vet closes, we can't get records unless for some chance you have a copy, which is pretty rare. Banfield now, just because they're like one of the largest, you can access your records online, which is amazing, but not everyone. So there's a lot of times, I mean, one of the most frustrating situations that I'll have is client goes to their vet, dog wasn't feeling well. They did all this blood work. They sent the blood work to the lab. Dog's still not doing well. They come to us the next day. We don't have blood work results. They're closed. It's at the lab somewhere. We don't even know what lab. And we're repeating tests. That's hard. That's a hard one to swallow. But it's just where we're at in terms of at least being able to give the answers and provide that care. So there are plenty of times when we don't have the records and we don't know what the history is, and we're basically starting from scratch. So I think probably like a better way might even be for you to have a copy of your records, because whether you're coming to EVS or you're going to Blue Pearl, it's going to be probably more efficient if you had that copy yourself. So interesting. I need to make a slide for that too. When I worked at Banfield, again, it's just because I worked there. I don't even know what the percentage is, but it was high. I mean, we're talking probably like 6 out of 10 of the pets you couldn't touch. And a lot of that had to do with how much stress was building. They're sitting in this lobby and it's crowded and it's loud, and they're getting taken into a treatment room without you and they're scared. We try to eliminate that as much as possible. So are there pets that we can't touch? Absolutely, right? And depending on the severity of their ailment will be a couple of options. Sometimes I'll send them home with the cocktail, but obviously if they're, I don't know, vomiting, that cocktail isn't going to be very helpful, right? Because, they're giving them oral medication. Sometimes we'll use injectable sedation, right? And we'll just say, listen, for the safety of everyone, a lot of times these pets are small, right? Like we can hold them down if we wanted to, but all that will do is make that next time worse and worse, and they'll hate even just seeing the clinic, right? So I'm a big fan of decreasing that FAS, using sedation, and I have plenty of people who will call, because I answered the phones last week. A lot of people are like, oh my God, it's terrible. I can't even get a leash on him. I don't know how you guys are going to touch him. It's like, okay, well, like let's start with giving some meds at home, and especially if they're calling early enough time, have those medications at home. They're able to give them and at least make it as manageable as possible. Evelina and I had a couple of cases about 2 weeks ago. Giant cane corso, and I say that those dogs scare me, but like we see because met one that is like nice and cuddly, like I want to like squeeze them and they are ready to eat my face. And so this dog had really bad ear infection, and what I found in this setting too is how slow can we go, and again, how can we involve safely the client who that dog trusts to help us with the exam, right? So that client put a muzzle on, they was sitting between their legs, and this dog was the happiest dog ever. And I was like, oh, wow, like this is amazing. And then unfortunately, they wrote this amazing review on Google. And it was like, Dr. Jordana was so great with our cane corso. I'm like, why did they say that? To meet all these dogs. I think that's just it. When you're working every 15-minute appointment, like you gotta go, right? Like, and if your dog's not cooperating, it's like, we're gonna get this done, because we gotta move on to the next things. We don't have that anymore. We get to spend as much time as we want. And I think that has really helped. So it goes back to that human animal bond. And, these pets, like you're their people, you are the ones that they trust and want to be with. And except for golden retrievers, they'll go with anybody. That has been a piece to me that, again, after 20 years of practice, I didn't experience when I was in general practice. I have, like other vets, kind of looked at the client as an obstacle to care, versus a solution to being able to really make everyone understand more. Yeah, so we have one here in Illinois, and then our other locations are spread across the country. So it's a great story also. So we have one in Florida. My niece is my managing veterinarian out there, which is really amazing. She was a new grad when I opened. She graduated in 2020, and she was actually working for a very busy Banfield in Orlando, getting a ton of experience. She was, I think, their highest grossing doctor as a new grad there. She was doing, you know, all the surgeries that they had. And when I brought this, to me, really out of the box idea, when we opened in 22, there were no other urgent cares here. And so I, you know, said, I have this crazy idea. I'm going to open this urgent care. And she's like, yeah, let's do it. And I was like, but you have like a really good job. And like, this is a startup. And I have no idea if this is going to, like, if anyone else is going to think this is a good idea. And Kissimmee took off from day one. I mean, they don't even have remotely what we have here in terms of the saturation of general practice vets and emergency. January of 24, we opened in Reno, Nevada. A doctor out there saw us on social media and was like, I love this idea and we need this here. We don't have anything like it. So I say, like, we dated for about a year and said, like, you know, I don't know you. So, like, you know, let's make sure this can work. So their practice is pretty awesome because she sees exotics and she's got people traveling like more than 4 hours to come to her because she is the only one in that area. And then this is the cutest story. So over the summer, my roommate from veterinary school messaged me and he's like, Jordana, how's it going? Right. And I was like, great. I haven't talked to you in like 20 years. But like, it's just like, he's like, I love it. I love what you're doing. And I want to do it here, but I need to see it first. So he comes and I mean, Evelina can tell you, I mean, it's almost like we paid all of our employees to like be on their best behavior. It's like, it was like someone's birthday and like, you know, she made a cake and I was like, well, it's just like every day or it's like eating cakes, seeing patients, you know, having a great time. And so we opened by him, which is just north of Buffalo, New York, at the beginning of December. So about a year ago, maybe it's a little bit more at this point, again, had this crazy idea, like I'm diagnosing dental disease probably about twice a month at EVS that needs to get taken care of urgently. I'm not talking about like, yeah, you got a bunch of plaque on your teeth, go have a cleaning. Talking about a broken tooth, a mobile tooth, severe periodontal disease. And there was one dog, it was a golden retriever. He came in, he had a broken tooth. Their regular vet said they couldn't see him, so they sent him to us. And I was like, well, he needs this extracted. And their vet couldn't see him for like months. I mean, it was going to be like, you know, their vet was out of town. And so they ended up sending him to Barrington, and which is great, nothing wrong. That's the dental specialist is out there. The cost is about 4 times what you'll spend at your regular vet. And it's a process, right? You got to go out there, you got to go do the visit, you got to do the blood work, you got to schedule it, you got to drive back out to, I don't even know where Barrington is, but it sounds far. Yeah. So, yeah. So so I said, what if we brought dentistry to urgent care? And I will say a lot of people raised their eyebrows at me, like, why that doesn't belong here? Like that's a general practice thing. And I challenged them. I was like, well, everything we're doing is a general practice thing, right? Like, I mean, we're seeing ear infections, we're seeing lameness, we're seeing broken toenail. But these pets are uncomfortable and they're in pain. And if we can make them feel better, let's do it, because you can't go to Blue Pearl or Vet Specialty or Elk Grove for a tooth root abscess. They don't have the tools to fix that. So we brought it in last year. It is the only thing that you have to make an appointment for. And it's been amazing because, again, we're not just cleaning teeth. We're diagnosing things that in, again, 20 years, I've never diagnosed. Because some of these patients, you know, the ones that we've seen so far, maybe they've never had a dental cleaning in their entire life. A lot of them don't even have a vet. I mean, we're not trying to take patients away from general practice vets. We're really trying to give another alternative there. So that's great. Blue Pearl actually just sent one, I think last month, which was really amazing. To be able to have that relationship there too. So yeah, we're doing the dentistry. It's great. It's very rewarding. I've tried to make it make sense too. So have any of your pets had a dental procedure? So when Evelina and I were doing the dental procedures, again, it was one of these things where like, I can't wrap my brain around this. I'm anesthetizing this dog, and then I'm calling the owner with like this ransom of like, it's going to be $2,000 or I'm waking your dog up if you don't call me back in like 5 minutes, right? And it's like, it's so not fair. Like, it wasn't fair to the patient to be sitting there under anesthesia. It wasn't fair to the owner to not really have any clue of how much something is going to be, and not be prepared at all. And again, the cost was really exorbitant, even in general practice for me. And a lot of that had to do with the way that we would charge would be by the tooth, right? So if you have a canine tooth, it's X number of dollars. And it doesn't matter if it takes me 15 seconds to pull it out or 2 hours. And I said, that doesn't sit well with me. So the way we do our dentals is there's a flat fee for the cleaning, the polishing, the x-rays, the charting, that's and the exam, that's about $500. Everything else is just based on time. So I feel pretty confident with myself and anyone else who's doing the dentistry that we're not going to be wasting any time there. So if it takes us, again, 5 minutes, super. And if it takes us 2 hours, there's a really good reason that it took us 2 hours. So I love being able to give clients an estimate and saying, like, this is how much it's going to cost, and this is why it's going to cost this much. And I feel like they've just been, you can speak to it too, I feel like they've been really happy with that service too. And I guess I'll just like end by the last thing I'll say is, well, the other thing I didn't anticipate being in urgent care is a second opinion, or third or fourth. And sometimes, like in the beginning, I would get really stressed about it. So like, oh my God, like, they didn't know. Like, why would I know? Because you're new. But it's crazy as disease progresses that things can be a lot more obvious as it gets a lot worse. There's this one guy that comes to mind, came in with horrible skin all around its paws, its elbows. And I looked at it and they said, we've been treating for allergies for months and it's just getting worse and worse. And I look at Evelina, I was like, that's not allergies. It's this obscure, what you call it, a zebra disease. It's called hepatocutaneous syndrome, where the liver starts failing and starts attacking the skin. And I never diagnosed it before. And the crazy thing is like, if I had been their vet in general practice, I would have been treating them the same way they did, antibiotics and Apoquil. Like, it's, you know, it's allergies, treat the obvious first. But that is one thing we've diagnosed a lot of very interesting things. But again, it's kind of after they've exhausted all of the more obvious diagnoses.